In this video, we will be reviewing the post-kidney transplant medical regimen that your healthcare team has discussed with you during your hospital stay. Following your transplant, there will be many additional medications you will need to take. Your healthcare team will discuss your personalized medication regimen with you, and it is important that you are aware of all the medications you are taking and the reason for their use. It is also important that you take your medications every day and never skip a dose. You will need to take anti-rejection medications for the rest of your life. If you skip even one dose, it increases your body's chance of rejecting your new kidney. You should never stop taking any of your medications without consulting your healthcare provider and transplant team. It is also important to consult your healthcare team and pharmacist before taking any new or different medications, including prescription, non-prescription, natural products, and supplements, because they may interfere with your transplant medications. Another important thing to avoid is getting grapefruit products because they can alter the medication levels in your body. In order to ensure that you don't run out of medication, make sure you have at least a 2-week supply of medication available at your home. I will now go over some of the common medications, their purpose, and possible side effects. Tacrolimus. Tacrolimus is a drug that suppresses the immune system to stop your body from rejecting your kidney. It is best to take tacrolimus on an empty stomach, and it should be taken at the same time every day consistently. If you are getting blood work taken, do not take this medication before your blood work is drawn. Bring it to your appointment so you can take it after your blood work is complete. You will also need regular blood test and dose adjustment while taking this medication. Side effects of this drug are higher risk of cancer and infection, stomach upset, headaches, high blood pressure, high blood sugar, and high cholesterol, hand trembling, and in rare cases, kidney damage. Another common medication is mycophenolate mofetil and mycophenolate sodium. These medications have the same use and drug profile. Mycophenolate is an immune suppressant that inhibits your immune system's response and is prescribed to stop your body from rejecting your donor kidney. This medication needs to be taken at the same time every day and is better to take on an empty stomach. This medication requires regular blood work checks and dose adjustment. Side effects of this medication are higher risk of infection, higher risk of cancer, upset stomach, nausea, vomiting, and diarrhea, headache, problems with your blood, such as low red and white blood cells and low platelets. Any symptoms of infection like fever, sore throat, chills, and fast heart rate need to be reported to your doctor immediately. You also should report any extreme tiredness and bruising to your doctor, as it may indicate problems with your blood. Prednisone. Prednisone is a corticosteroid that is used to suppress your body's immune system and stop you from rejecting your transplant. Prednisone can be taken with or without food. Side effects of this medication are higher risk of infection, high blood pressure, high cholesterol, high blood sugar, and upset stomach, fluid retention, bone weakness, and mood changes. Prednisone can make underlying psychiatric illnesses worse, so if you have problems controlling your mood, contact your healthcare provider immediately. You should also contact your healthcare provider if you have symptoms of infection and if you are feeling puffy or swollen, like you are retaining fluids. Following the lifestyle recommendations mentioned in this video can help you to reduce some of these side effects. You should also be aware that you may be prescribed antivirals and antibacterial medications to prevent and treat infections that you are at an increased risk of because of your immunosuppressant medications. To ensure you are taking your medications in the correct dose and at the correct time, there are several methods you can use to help you. You will be given a piece of paper called the medication record sheet to fill out that will list the name of your medications, the dose, how often to take the medication, reason for administration, and time of day you take the drug. By filling out this sheet with your healthcare team, it will be a helpful resource for you to keep. Some patients also find it helpful to set an alarm on their phone when it is time to take their medication. Other patients ask the pharmacist about the use of a blister pack to make pill organization easier and more convenient.
After your kidney transplant, your lifestyle may require some adjustments. Part of this includes taking your weight and vitals daily. It's important to take your weight at the same time each morning after you have emptied your bladder. Report if you notice a weight gain of more than 3 pounds. You should also take your blood pressure at least once a day. You can do this at the same time as your weight. It's important to know what a regular blood pressure is for you and to keep in mind when you have taken your blood pressure medications. If you experience fever or chills, take your temperature. This could be an early symptom of infection or rejection. Monitor your fluid intake and output for the first 6 weeks after your transplant. You will be given logging sheets to help with this. Nutrition will also become very important after your transplant. It's best to eat regular meals with a variety of foods from each of the 4 food groups. As osteoporosis can be a side effect of your new medications, it's important to eat calcium-rich foods. Proteins can help to prevent muscle loss and promote wound healing post-op. A low-sodium diet is also recommended. If you're a smoker, it will be important to take measures to quit. Be aware of available help and support groups for doing this. Alcohol should also be avoided due to medication interactions and more. You will need to avoid strenuous lifting for at least 6 weeks after your transplant. Avoid lifting more than 10 pounds. Mild exercise such as swimming and walking is recommended, but be sure to consult your transplant team beforehand to be sure. Exercise can help with inflammation and impaired immune function. Maintain your overall health by having regular checkups like eye exams and visiting the dentist. Brush your teeth twice daily with a soft bristled toothbrush. Be sure to wear your medical alert bracelet at all times. Sexual activity can be resumed as soon as you feel well enough. This will usually be about 6 weeks after your surgery. Some medications may decrease sex drive. Driving will not be permitted for 6 weeks post-transplant. Most people can return to work within 3 months, depending on the physical demands of their job, their age, and the stress that comes with their job.
Occasionally, problems can happen after your transplant surgery, such as a risk of falls and injury. This can be due to sedation and impaired mobility after transplant. There is an increased risk for falls that could damage your incision site or your body. To help prevent these falls, always ask for help when feeling unsteady. It's better to be safe. And have your personal items within reach and take your time when walking and using stairs. A kidney transplant is a major surgery, and with that comes a risk for infection. Monitoring your incision site is very important to check for signs of infection, as well as knowing other potential risks. These can include taking prescribed immunosuppressants, which actually can suppress your immune system and weaken your body's defenses against bacteria. Being exposed to someone that is sick, as well as having an indwelling catheter, a drain, or an endotracheal tube, are all risk factors for bacteria to be introduced to your body. The signs of infection that you need to be alert for include a fever over 37.5 degrees, pain while urinating, which could indicate a kidney or bladder infection, foul-smelling urine and the sudden urge to urinate, coughing, sore throat, fatigue, cold sores, change in phlegm color, and pus, which is green-colored, or sanguineous drainage, which is bloody, leakage from your incision site, as well as redness, swelling, and pain around the incision site. There are 2 main types of post-op infection, one being at the incision site. This is usually treated with antibiotics. However, you may need special dressings placed over the incision to help it heal. This can be caused by impaired skin integrity, which often causes the risk for infection. This is usually caused by excessive pressure on the wound site and stress to the surrounding skin, causing it to open and can actually damage the healing process. You also can have infection in other parts of your body, which are common side effects of anti-rejection medications. Infections are usually treatable, however, in serious cases you may need to decrease or stop one of the anti-rejection medications. In order to prevent infection, you need to be monitoring for these signs of infection daily. Routine blood tests need to be performed to look for the white blood cells in your body which indicate an infection. Trying to limit contact with strangers or people you know that may be sick, as well as continuing monitor the incision site and being diligent with hand hygiene is extremely important to prevent infection. There is also a risk for organ rejection. Rejection happens when your body's immune system recognizes your new kidney as foreign. If rejection happens and we don't treat it, it can damage your transplant. That's why it's important to treat a possible kidney rejection early to improve the chances of the kidney's recovery. Rejection usually occurs in the first 3 to 6 months post-op, and the signs and symptoms are not always clear. That's why it's very important to continue getting your regular blood tests. If your physician predicts organ rejection, you will undergo a procedure called a biopsy. This involves putting a small needle into your kidney and getting a small piece of it to look at under a microscope. They will also look for a higher serum or blood creatinine level in your blood tests. Signs for you to look for at home include a fever over 37.5 degrees Celsius,
fluid retention, and pain or tenderness around your kidney incision. Fluid retention can cause electrolyte imbalances, therefore monitoring your fluid input and output, as well as diagnostic tests to check for these imbalances is very important. If you have a diagnosis of rejection, the most common treatment is an IV drug called Solu-Medrol. This video is only a general overview of the post-kidney transplant guidelines. Your healthcare team will be the main resource for personalized information regarding your post-transplant care. Please contact them with any questions and ensure you have a full understanding of your condition and care plan prior to discharge.